Good morning, Don here. Welcome to the $1 Million Minute, where I'm going to go over the things that helped get the practice to the $1 million mark and beyond. This day, we had, I think it was 22 patients. I usually have about 22 patients starting in the morning. EPAT number 3. So EPAT number 3 is the third EPAT. This is the second MedHead. I do a 6-week follow-up for this patient and then a level 3 visit because I talk about what we could do next if it doesn't tend to get better. I started to tell people when I do shockwave since this recent conference that it takes about 6 months total to see the improvement from the shockwave, but it maxes out at about 3 months, where the best feeling is about 3 months. So I do a 6-week follow-up and then another 6-week follow-up. I was telling some other people there are some shockwave codes that we are trying to bill. We received a SoftWave, not an EPAT, but a SoftWave in our office, which is an unfocused shockwave, so I've been playing around with that. And we're trying to bill out a few of those to Medicare to see if they are covered. I'm not sure if they are. I'm kind of not hoping they're not, but we're one of the other doctors in the office is doing that. Next was a patient that came in for a bilateral matrix because of some chronic ingrown toenails. Then they also had 2 porokeratomas, so we did bilateral lesion destruction with a level 3 visit for that one. Another one was a patient that got lesion destruction. This patient had a really bad reaction to Swift. Only did 1 Swift treatment, but he was in pain for 4 weeks after. I've never had that. I think I might have been a little heavy-handed on that, but then I did 2 cantharidin, actually 1 cantharidin and then 1 just salicylic acid today, and his warts went away. They were really kind of a chronic wart. So despite it hurting a lot, I think it did its job. Another patient came in for an MRI follow-up. This is a patient that had a foot sprain about 6 months ago. Hasn't gone away. MRI showed a Lisfranc, so I referred that to one of my other colleagues here that will repair the Lisfranc injury. Another patient that came in today, this was a Lamisil booster patient follow-up. So nails are looking really good, and then I prescribed ketoconazole to get another level 4. And then they're going to use after they finish the Lamisil once a week just to prevent any recurrence, along with the other things like the shoe sterilizer that they're using. Post-op patient, actually this is a patient that had a cyst. I have popped it a few times, they popped it a few times, they're frustrated, so he wanted to do the DIPJ fusion to not have the cyst come back, so we're going to schedule that for him. I'm booking on about 6 months, and he's okay waiting with that. Just so you know, this next year we got our surgical schedule. I have 6 surgical dates in next year, and so I think by making me less available, I'm tending to do less surgery because I find surgery less profitable. So that's the way I do it. And then I refer to the other doctors in the office if they want to do them. That's kind of the way I think about it. Not everyone might think that way. You might love doing it, but if you talk about pure profits, I'm not sure if that's the best way or use of my time. Another patient that came in for EPAT number 1 with an ultrasound for plantar heel pain. I set up number 2 and number 3. There's a patient that came follow-up of heel pain. The funny thing is they said, well, I don't want to do shockwave yet, but I'm going to do what I didn't do before, which was the night splint, foam rolling, morning stretch, things like that. That was kind of a funny quote from this patient. I'm going to do what I didn't do, so I'm going to see this patient back if it doesn't get better. Another patient came in for plantar fasciitis number 1 with x-rays bilaterally, plantar medial heel pain, did the night splint, foam rolling, morning stretch, things like that. And meloxicam. I haven't started doing the Alleviate that I talked about before, so I don't have that to offer. They're still kind of doing the foam rolling for now until I kind of figure that out. Another patient came in. They did laser treatment for their nails. They are looking better. I'm going to see them. They did 6 sessions. Last one was today. I'm going to see them for a 3-month follow-up. They also desired orthotics, so I scanned. This was probably my MVP patient, and I scanned this patient for orthotics today. Another patient, 2 other patients came in just for nail care, new patients. Then they'll be set up on our routine day. We do have our nail tech up and running. Marjorie, she's going to be with me today, which is the day after I'm recording this. I'll let you guys know how this goes. Another patient that came in, this was a patient with a retrocalcaneal bursa, posterior to the Achilles, and I did a cortisone in there, x-ray, ultrasound, cortisone, and I'm going to have them wear a boot for 3 days. But I did stay away from the Achilles tendon. It's deep to it, and so she felt a lot better, and she's going to be in the boot just to protect it. I did see Swift. I did Swift number 3 on this patient. They're going to be here for the 3-month follow-up. They're responding quite well with that. I did another IND for a nail, level 3 visit, level 3 with lesion destruction with cantharidin. These are both new patients. And then an EPAT patient where I did my first combo, radial and SoftWave. Because at one office I have radial and focused, and at my other office I have radial and now SoftWave. So I'm just adding SoftWave on. I'm not charging it. I'm not charging for it right now because we're still kind of playing around with it. And I set up number 2 and number 3 for the next ones. This was another patient that came, a 25-year-old guy, follow-up after plantar fasciitis. He got like 80% better with just the foam rolling. So I think it was more of a tightness issue for him, and he felt a lot better. Another patient that came in for hammer toe, wanting a hammer toe surgery. Hammer toe was drifting over the bunion a little bit. I discussed about the surgery and things like that. But it's really not painful, so I did recommend correct toes and anatomic shoes initially. It's not going to, I agree, not going to correct that toe position, but if it's not hurting her, I'm going to try to do it this way versus doing a surgery. Then there was another patient that came in. Their ankle pain was better. They had some toe pain. I evaluated, but it was fine. This was a little girl, so that was just a level 3 visit. Another young woman, 16-year-old Irish dancer, and she, because of the hard shoes that she wears that are hard in the back, she had like an Haglund's back there that's rubbing, and they're going to be doing 3 sessions of shockwave in the office to calm that down. And another patient came in for a couple of issues, and they had a split nail. They were kind of concerned about like a melanoma, if it could be causing it. I evaluated it. There's really no darkness on the nail, so there's no need to biopsy it. Just kind of evaluate it. Didn't really have to do anything. I'll see their back as needed. And then there's another patient that came in for a Lamisil follow-up, and they had heel pain. So they got my heel pain special, night splint, foam rolling, morning stretch, things like that. Because of the equinus, and it's kind of a mild level of heel pain, so I'm not seeing the back. I was looking this week over our numbers. I just want to share these with everyone. And I put this on, I have a WhatsApp group that I coach people on, and so I kind of post these numbers there. And I just want to kind of give you an idea of what is working for us and in terms of the numbers. So let me just go over this. Oh, another thing someone was asking me about, we got a new digital signage, and the company that we use is XOGeo. XOGeo is a place we use for a digital sign. So you can look that up if you want. So then my November numbers, I had 370 patients. 61 of those are new patients. So we try to get about 20% new patients, so a little bit under 20%. I had 11 no-shows. My per claim value was 167, and then the total revenue generated was 108,000. So as I'm looking at this 2024 numbers, I started in January like at 76,000, went up to 86, 96, 86, 117, 111, 95. 113, 110, 138, which is the best month, and then 108. So it was a good year. I tended to find it tended to trend upward, and especially my per visit value claim has been going up. So I think that's attributed to 2 things. I think it's one, not seeing back low level patients, meaning paronychia follow-ups, random patients, just not having them come back. Excuse me. And then focusing more on higher level things like shockwave, orthotics, DME, and procedures in the office. And that was the way that I started out, because I started out this year at 126 per claim, and now it's at 167. So I think a lot of it is just kind of keeping your eye on the prize. That's why I do this every day for you. If you guys are having great success, or if this is helping you think outside the box, or if your numbers are going up, let me know so I can know to keep doing this. Okay, hope you guys enjoy this. Please give me your feedback. Okay, have a great one.